Okay, it's Janine again. The meeting is now streaming on YouTube, and you can start whenever you and Ashley are ready.
Thank you. First, I'd like to say good afternoon. Today is a new day in America, transition of new leadership. May democracy in these United States continue for all the citizens that reside on this soil. And we've all seen some unprecedented times and an overabundance of needs for our county, especially in food, housing, employment, mental health services, and et cetera. This is the first Health and Human Services Committee meeting for 2021. And I want to thank all my colleagues, Brown, Miller, Stevens, and Sweeney, who have committed themselves to work on these issues with me that come under the HHS umbrella. A special welcome to a new colleague, County Councilman Marty Sweeney, who recently joined council. And I would like to now call to order Wednesday, January 20th, 2021, the Health and Human Services and Aging Committee to order. Madam Clerk, roll call, please.
On the roll, Ms. Conwell.
Present.
Mr. Sweeney.
Present.
Ms. Brown. Sorry, Ms. Brown.
Here.
Mr. Miller.
Present.
Ms. Stevens. I see Ms. Stevens is here. We have a quorum.
Thank you. I'd like to take a moment of silence for our colleague's brother who passed away, Scott Tuma's brother, last night. Thank you. Madam Clerk, was there any public comment?
No, Madam Chair, no one submitted any public comment.
All right. Approval of the minutes from the December 2nd, 2020 meeting. Can I have a motion and a second, please?
I so move.
Excuse me, Madam Chair.
I didn't hear who the
Second.
second one.
Stevens.
Okay.
Stevens.
Moved by Miller, seconded by Stevens. All in favor, say aye.
Aye.
Okay, we have a couple of
Aye.
items. We have a couple of items that are referred to the committee today. And I believe that Dave Merriman will let us know who is here to speak in regards to those. So Madam Clerk, if you could read the first item into the record, please.
Resolution number 2021-0029, authorizing a contract with United Way of Greater Cleveland in the amount not to exceed $1,145,450 for fiscal agent services and emergency food purchase assistance by Hunger Centers serving eligible Cuyahoga County residents for the period January 1st, 2021 to December 31st, 2021.
Welcome, Mr. Merriman, who is here to speak to this item.
Good afternoon, Councilwoman Conwell and members of council. First, I want to thank Councilwoman Conwell for her remarks to begin the meeting, and I think we all agree with you in the excitement and for the year and the term to come. This first item today is our annual contract for emergency food assistance. I'm going to ask Dan Humphrey, who is serving as the interim director of the Contract Administration and Performance Unit, to present this item. I know that Dan has been joined by Nancy Mendez from United Way, Julie Johnson from the Hunger Network of Greater Cleveland, and then Kimmy Lovano from the Food Bank. I believe they may have other staff here in attendance with them, but I'm going to ask Dan to introduce the item, and we'll bring forward our providers as needed to answer any questions. Dan.
Thank you, David. Good afternoon, Madam Chair. Dan Humphrey, Interim Administrator for Contract Administration and Performance. This item is for a contract with the United Way to provide professional services relating to the allocation of funds for the emergency purchase of food by hunger centers in the county to serve eligible individuals and families. The United Way administers the funds through the Federal Emergency Agency's Emergency Food and Shelter Program through the local county board. The total amount of the contract is $1,145,450, of which $55,450 is for administrative costs, and the remainder goes to purchase food. The program provides food through 37 hunger networks within the county. and the United Way works to allocate funds between those and provide ongoing evaluation of the service. As Mr. Merriman mentioned, we're joined by multiple representatives to answer questions about the specifics of the program.
All right, I'd like to open it up to my colleagues. Any questions in regards to this?
Councilwoman Conwell.
Councilwoman Brown.
Thank you very much. See, Ms. Johnson is on the call. I had the privilege of crossing paths with her on Martin Luther King Day. I would like to present a question that I think would be beneficial to the group. A lot of times people aren't familiar with the differences between the food bank and the hunger network. So if she wouldn't mind touching on that and sharing how the differences and how under this pandemic you have been able to collaborate and work together to serve greater members of the community, please.
Thank you so much. Good afternoon, Madam Chair and council members. I would be glad to address that question. And it was my pleasure indeed, Councilwoman Brown, to meet you. So Hunger Network and the Cleveland Food Bank work hand in hand. The majority of the food that we purchase through our pantries is actually purchased through the Greater Cleveland Food Bank and supplied to our neighborhood hunger centers. And we actually have 73 of those. Some of those are hot meal sites and some of those are pantry sites. And there are 32 that are under consideration for this contract today for the food provision through this contract. So we provide the funding through this contract and we allocate it to our different 32 hunger centers. And then they utilize that money to purchase food at the food bank because the food bank has a large purchasing power and purchasing program, and they can purchase food at a huge volume and a huge discount that we would not be able to provide. Additionally, throughout this past year and this pandemic, we've cooperated on things like the USDA Farmers to Families Food Box Program to distribute tons of boxes of fresh produce and dairy. And then the food bank was providing actually free meat through this program to pantries, not only those within this network, but pantries all across the greater Cuyahoga area and likely in other counties. I'm not certain of that, but I know it was here in Cuyahoga County because we helped with some of the distributions. And so we really work hard together, and we're even trying to find better ways to work together and collaborate together to make sure we're providing the best service to the community possible.
Thank you very much, Madam Chair.
Thank you. Any other questions from my colleagues? Hearing none.
Madam,
Councilman Miller.
thank you. And my question is if you could provide some information about what the current demand for food is as how it's been affected by the pandemic.
Sure. Councilman Miller, my name is Jessica Morgan, and I am with the Food Bank, and I would love to answer that question. Thank you, Madam Chair, for the opportunity, and the rest of council. Good afternoon. The Food Bank has seen an incredible demand since the start of the pandemic. We put some data together that I think really hits home, particularly around the number of new families that have visited a food pantry within our, we serve 6 counties in Northeast Ohio. So within our entire 6-county service network, we have seen, I believe it's over 56,000 new households that have never visited a food pantry before. So that is just unprecedented. It is something that ourselves, along with our partnership with the Hunger Network, have been keeping a close eye on how we need to respond to that. Unfortunately, you know, when vaccines are distributed, it doesn't necessarily mean that this pandemic is over. The effects of the pandemic are going to be long lasting, years ahead, as unemployment continues to be very unstable. And so I think that we have a lot of work ahead of us, but I know that we are all very committed to making sure that we think creatively and differently about how we address this new normal.
And if I could just add, my name's Nancy Mendez, Vice President of Community Investment at United Way. And I also oversee our 211. And I could tell you that in March alone, we saw a 191% increase in calls for food. And that has remained on average about double the amount of calls that we receive for food has again, it's doubled in the past 10 months. And many of these callers have never called 211 before, and they saw themselves for the first time in March and April calling and specifically asking for food. And then the next highest ask was for utility and rent.
So to follow up on that, does the food bank have sufficient food available and distribution capability to meet the need, or is there unmet need out there at this time?
We are looking at communities at this time where there could be some unmet need and discussing ways in which we can help to intervene. Unmet need could be seen a couple of different ways, and we've got a great data team that's helping us to define that. You know, one of the things that we're keeping a close eye on is the amount of federal support we have. Ms. Johnson mentioned the Farmers to Families Food Box program. We're currently entering phase 5 of that program, but we are not guaranteed a phase 6 and beyond. That is great free food that is made available to food banks and nonprofits and gets into the hands of families very quickly. That is not guaranteed. So we have a budget, and we are evaluating constantly what we need to do to step in to make up for any sort of downfall or deficit when it comes to some of those federal commodities that are certainly not guaranteed. We are certainly hoping to build off of the sentiment at the start of the meeting that this is a new day and a new administration, and hopefully relief will continue. And so we are certainly very hopeful. But we do have plans in place for this year to intervene when necessary when it comes to additional food purchases should we need to make them.
Thanks very much, Madam Chair.
All right, I have a question for Mr. Merriman. There has been some additional funds that were allotted to the food bank during this time. Was the Hunger Centers beneficiaries of any of this additional funding?
Councilman Conwell, yes, we were able to find an opportunity using community development block grant funds to fund the Hunger Network for expansion of their services. These were not Treasury CARES dollars, if you will. Those were the funds that we used for the food bank as well as United Way and others. These were HUD CDBG dollars that, quite frankly, have a little bit longer time frame to utilize. So for us, there was, I think, a great opportunity to partner in this way. We were also very grateful to have an anonymous donor step forward, and our funding leveraged theirs. And we hope that this will become a community investment. So yes, we were able to support the Hunger Network, the food bank, and United Way, because all three are really critical partners for us.
Thank you. I want to address a question to Ms. Julie Johnson, just so I can have a clear understanding. The selection process of the Hunger Centers that are eligible under this program, how are they selected?
Well, we do have a staff person who works with those pantries to select. And normally the pantries that we select are those that are larger so that we're assured that the dollars are meeting more needs. So there's a certain certification process that they go through. They do have some training through the food bank because they have to learn how to handle all the food at appropriate temperatures and things like that. And then we help them set up an infrastructure in these Hunger Centers to allow them to distribute food. We also help them with obtaining equipment through some other additional fundings that we have, usually through the foundation community, such as refrigerators, freezers, shelving, and the like. And then we make sure that they adhere to some guidelines. And then all three of our organizations collaborate to do evaluative site visits. And this year they had to be virtual. But we also do some surveying to make sure that we're meeting the needs of the community and that they're happy with the service that's provided, that they're treated with dignity and respect. when they attend the different pantries, and then we have ongoing monitoring with them. So kind of what Hunger Network does is at the local neighborhood level, we provide a lot of technical assistance and kind of individualized support. And then the hunger centers usually offer much more than food, because in pre-pandemic times, they were used as neighborhood gathering places. So they have a lot of social outlets, and some of the pantries are in other nonprofit organizations such as University Settlement, who have other programming that we refer the clientele to in assisting them. We have also had a Stay Well program at Hunger Network in the past. We're trying to figure out how we're going to do that, because as you can imagine, the centers have been closed down. Well, not closed down, but they have not been doing indoor distributions. It's all been outdoor, and we would do some health screenings in assistance with MedWorks and kind of get folks to different things that they needed to. We did blood pressure, those types of things, blood sugar testing, some chronic disease management and referral. So those are all of kind of the different criteria, and then they're evaluated. There's also some different compliance things they have to adhere to. They obviously have to provide all the information necessary in Pantry Track, which is the system that the food bank requires, and we require that all of our pantries adhere to, so we can have these statistics to tell you how many folks are served, how many pounds of food are delivered, et cetera. And we make sure that the pantries are open generally when they do the county funding, a minimum of 2 or more times per month. So it's we have some smaller pantries that are once a month, but we try to have the larger ones that are open for a greater variety of service and a greater number of days to encourage, accessibility to the community.
Were there any, Julie, that were not funded?
Well, we have 32 that are funded through the county contract, but yes, we do have more. We actually have 50 pantry sites, and the ones who aren't funded through the county are called auxiliary sites. They're generally smaller sites that may only be open one time per month. And then additionally, we have 23 hot meal sites as well that distribute food, though they have been somewhat challenged, as you can imagine, during the pandemic. And we've come up with some other opportunities for them as well.
Thank you. I'd like to open it up again for any of my colleagues that may have additional questions. Okay.
Councilwoman Conwell, on behalf of the department, given this is an emergency food service program, we would like to request passage in 2 readings.
I was going to do that, Dave.
I was saving you the question simply because we're bringing this to you.
I wasn't even going to ask the question.
We
I wasn't
know
even going to
that
ask
you'd like to have everything read 3 times. You follow the rules. They have that as an expectation, but both this and the next one, unfortunately, they came in at the end of the year. We're in a bind and they're critical services. And I feel like there has never been a time where the name emergency food purchase assistance is more apt.
And you stole my words from me. One last time, any additional questions from my colleagues before we pass this forward? All right, hearing none.
Madam Chair, none. In the spirit of moving quickly, I make the motion.
Some?
No,
Okay.
in the spirit of moving quickly, I give you my name to make the motion.
All right. And as I was going to say, one of our most important contracts that will definitely pass this year under second reading suspension. Can I have a second?
Second, Brown.
All right. Moved by Stevens, seconded by Brown. All in favor to move this to the full committee of the whole under second reading suspension, please say aye.
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 Okay, thank you. Madam Clerk, if you can read our next item into the record, please.
Resolution number 2021-0031, authorizing an amendment to a master contract with various providers for out-of-home placement and foster care services for the period January 1st, 2018, period to December 31st, 2021, to remove various providers effective January 1st, 2021, to change payment rates for various providers effective January 1st, 2021, and for additional funds in the total amount not to exceed $61,500,000.
Thank you.
Madam Chair,
Mr.
David
Merriman?
Merriman, the Department of Health and Human Services. Before I introduce Cindy Weiskettle and Dan Humphrey to present this item, I do just want to let my colleagues know from the prior item, this is a public meeting. You're welcome to stay on. You're also very busy professionals, so we will understand if you also need to sign off and move on to other business. Madam Chair, before you is the annual master service agreement. Cindy Weiskettle's team has assembled this item working with our contract administration and performance unit. So I'm going to let Dan Humphrey and Cindy Weiskettle introduce the item. Cindy, if anything you'd like to share before Dan gets into specifics.
No, only what you just already said about the last contract. This is some of the most critical work we do at DCFS. Our board and care contracts are the biggest contracts we have. The placement of children is one of our biggest responsibilities. And so a lot of work has gone into putting these RFP together.
David, I'm actually going to pass this to Paul Porter, who's a little more familiar with the details and complexities of this contract.
Thanks, Dan, and thanks, Madam Chair and committee members. This is our annual board and care funding, as Director Merriman mentioned. This is an amendment that's roughly the same amount as our funding for calendar year 2020 was. As you can see on the agenda, this covers funding for approximately 51 vendors providing this service under the master agreement. There were some vendors that opted not to continue providing this service. They weren't necessarily removed by DCFS due to any issues with those vendors. It's just because we were doing an amendment, they had the option to determine whether they wanted to continue providing services this year or whether they wanted to roll off. I would like to indicate we are doing an RFP. We're preparing that RFP right now for services that will start January 1 of next year. We're confident that this funding will allow us to continue to provide these services throughout 2021. And I would open it up to any specific questions about the service. And I may defer to my colleagues from DCFS if you have any program specific questions, but I'd be happy to answer any contractual related questions.
All right, I have one for Mr. Merriman, or maybe it's for you, Paul. I see the list, the top list in the agenda are the ones that are remaining on, correct? The providers that are remaining on. And so I see item J, and I know that I've had some discussions with Mr. Merriman about item J. Could you please share why item J is still in there?
Carrington Youth Youth Service, I'm sorry, Carrington Youth Academy LLC.
Okay. Is that the same Carrington that we've had conversations in regards to prior?
It is, and so you know, at the time that we started working on this contract, they were still to be included. You know, we did not feel the need to pull the contract back and to drop them. I still would say it's a department decision whether we continue to place children with any provider, and that decision is made in the best interests of the child. Without getting into the specifics of any concerns we have, I don't know if Cindy or David Gray from the department would like to share anything about our current utilization of any of the providers on the list.
So again, this is my name is David Gray. I am the senior manager of our contracted resources and placement department. So just speaking to Carrington specifically, at this time we don't have any youth, you know, in that program. You know, we are still in the process, you know, of evaluating some things going forward, but that's, you know, part of a larger conversation. But just to, you know, to reiterate, we don't have any kids there currently at this time.
Okay, is that just for DCFS or is that any children in the county? I thought they still had children there.
That's correct. They do have contracts with other counties, and they are still servicing some of those counties.
Okay, but none from our county.
That's correct.
Okay, Thank you, Mr. Gray. I'd like to open up for any questions from my colleagues in regards to this board and care contract.
Madam Chair.
Councilman Miller.
Thank you, Madam Chair. And my question is whether we have a formal evaluation process in place, and if so, what the criteria are and what kind of reports are generated, and how we use the information that's generated.
Thank you, Councilman Miller. We do conduct regular contract evaluations on these vendors periodically throughout the contract period, as well as when we're preparing actions like amendments and new contracts. We look at, the ability of these vendors to serve the clients that they're serving, how responsive they are to placements when we make a request to place a child there. And David, I don't know if you'd weigh in on any more specifics of what your program team evaluates, but those are just a couple of things that we look at when we're preparing the item to be submitted. And those contract evaluations are included as part of the packet that we submit that I believe goes to the committee members, but I'm not positive.
Sure, and just to add on to what Paul shared, for each provider that we have a contract with, we also assign a resource manager. So all 50 plus providers have specific staff within our department that's responsible for continuing monitoring of the program, sort of serving as a liaison between their program staff and our staff here at the agency, but also, with the state licensing specialists as well, so that we can have some continued oversight of each of those agencies.
Thanks, Madam Chair.
Thank you. I have a question for Paul or David in regards to the changing in payment rates for the four on the bottom, the four agencies. Could you please elaborate on that?
Do you have a specific question about the rates for those vendors, or just
I wanted to know if they were increased specifically for those agencies, and what would the reasons be?
Correct. Those were increases for those agencies, and they were based specifically on asks from those agencies that their cost of delivering the service had increased higher than what they proposed at the beginning of this contract, which started in 2018. So they were specific requests that those vendors made to get slight increases to their rates in advance of us issuing an RFP for services to start next year. Basically, and David Gray, if you'd like to weigh in here, I think the argument was it was costing them so much more to provide the service that they were really rate increases that were needed to help carry them through 2021, with the understanding that if they submit a proposal, their rate will be higher than what it was in 2020 and prior to that.
And I'm surprised that that it was just four of them that made that claim. But David, if you could shed more light.
Sure, I would agree with everything that Paul just said. I also think, part of the process is, them projecting out programming levels and how that's also going to supplement, how they factor into their annual budgets. And so some of it has to do with fluctuations within their own programs and how that may or may not be able to offset, by their current rates. There's also some issues around 4E reimbursement and how they may be able to, adjust and accordingly related to what else they're receiving back as part of our placements.
All right. Any additional questions from my colleague?
Nope.
All right. Hearing none. I thought I had one more. Oh, my last one was directed, I guess, to Mr. Merriman or maybe Director Wisetettle. out of the agencies that are going to benefit from this contract, how many are out of state placements?
I don't know that we will know that by looking at the list, but what I would like to ask is I'd like to ask our team to, we can send you the same list with whether they're in-state or out-of-state. We would have to do that after the meeting if that's okay.
Okay.
What we can tell you is most of them are in-state, but we will get you the
Okay.
list that tells you which are which.
Okay, thank you.
You bet.
Madam Chair,
Yes, Councilman Miller.
thank you. To follow up on that, when you provide that information, could you also indicate which are within Cuyahoga County and which are out of Cuyahoga County but within the state?
Yes.
Thank you.
All right. Any other questions from my colleagues? Any additional information that you would like to share, Mr. Merriman?
Just anticipating your next question, and I'm not sure if I want to steal your thunder a second time.
You are fine. I've looked at the dates and I know we're dealing with N4, we're dealing with the pandemic, we're dealing with a lot of stuff. So I have been very lenient during these times. I know I'm a stickler, but I've been very lenient. So I know second reading suspension, and I'd like to make the motion to move this to second reading suspension. Is there a second?
Second, Miller.
Second.
Okay, so we've been moved by Conwell, seconded by Miller, I heard, to the full council under second reading suspension. All in favor, please say aye.
Aye.
Aye, all right. I only heard 2 ayes, so I'm hoping that if I can hear one more
I
aye.
was on mute.
All
Aye.
right. So I know I have a quorum for sure that this has been moved to the full council under second reading suspension.
Thank you very much, Councilwoman. We know that this is not what you like to do as a matter of practice, and we appreciate your consideration.
Oh, no problem. And I'd like to ask Madam Clerk if there was anyone or my colleagues, any miscellaneous business that anyone would like to bring up at this time. Go ahead. I heard somebody.
No, I said not today. I'm sorry.
Okay. Thank you, Councilman Sweeney. Mr. Merriman, I know you're waiting my list, and it will be coming to you shortly in regards to the schedule that I have laid out and planned for the various departments and various agencies to present to this committee throughout the year. So I will get that to you shortly. And would you prefer that I send it directly to the directors or to you to disperse?
Councilwoman, whatever makes the most sense for you. I'm more than happy to have you communicate with department directors directly. I'd like to be CC'd on it just to make sure in case someone gets called off or is on furlough or something, that we have coverage, or that that maybe that's a time for us to reschedule. So whichever works best for you, we're happy with. And we will attend and present at your discretion.
Okay. So I just wanted to let the committee know, as well as the new committee members, that and going forward, we want to, for HHS, make sure that we have a scheduled plan throughout the year for all the agencies to report to us on various topics, or if there's no crisis that they're facing, to at least let us know what is going on and what are some issues, so we can be well prepared before the budget time. So with this, I have no other miscellaneous business. I will open it up one more time to my colleagues if they would like to share anything. Hearing none, this meeting is adjourned. Thank you.
Thank you.
Thanks.
Bye-bye.